This morning, Oregon Congressman Greg Walden and Kevin Brady from Texas, the two chairmen of the committees responsible for the bill, discussed some of the details.
Good morning. Yesterday, the House Energy and Commerce Committee and the House Ways and Means Committee released the American Health Care Act. It's the budget reconciliation legislation that's part of the House Republicans' efforts to repeal and replace ObamaCare. After years of ObamaCare's broken promises, we're proud to put forth a plan that represents a better way for patients and for American families. And this morning, Health and Human Services Secretary Tom Price sent us a letter on behalf of the Trump administration in support of our legislation. That's a first step on the path to fulfilling our promises to the American people. We welcome President Trump's and Secretary Price's support. We will continue working closely with them and our colleagues in the Senate to get this bill passed into law. Let me be clear. Our plan is the first step. Under our plan, we are moving forward in a positive direction to rescue the individual insurance market and give flexibility to our states. We are protecting those patients living with pre-existing conditions under our plan. We are not returning to the days of lifetime or annual limits. And we will continue to allow young adults to remain on their parents' policies until they reach the age of 26. And we will keep our promise to not pull the rug out from anyone, including those on Medicaid. We are also creating a new and innovative patient and state stability fund to help low-income Americans afford health care and to repair the damage done to state insurance markets by ObamaCare. And we return power back to the states. We strengthen Medicaid and we prioritize help for our nation's most vulnerable. Simply put, we believe we have a better way to deliver solutions that put patients, not Washington bureaucrats, first. We provide the American people with what we've asked for and what they've asked for: greater choice, lower cost, and flexibility to choose the plan that best suits their family's needs. Introduction of this bill is just the first step in helping American families across the country obtain truly affordable health care, and we're eager to get started. I now turn it over to my colleague, the Chairman of the Ways and Means Committee, Mr. Brady.
Greg, thank you all for joining us today. 7 years ago, ObamaCare put Washington in control of Americans' health care. And for 7 long years, this failing law has hurt more people than it's helped. Families can't afford their premiums. Patients can't visit the doctor that they like. And fewer insurers are offering coverage options every day. It's getting worse. With President Trump now in office, House Republicans are taking action to deliver relief to Americans now. This week, House Republicans have introduced legislation to repeal this failing law and help ensure Americans have access to health care that's tailored to their needs, not health care dictated and tailored to Washington's needs. The American Health Care Act transfers power from Washington back to the American people. We restore state control of health care so it can be designed for the families and communities in each state. We restore the free market so Americans have a greater choice of products tailored again to what they need, what their family needs. So, in the Ways and Means Committee, our role is first to act now, dismantle Obamacare's unpopular taxes and mandates that have hurt jobs and driven up health care costs, to enhance and strengthen health savings accounts so people can spend their health care tax dollars the way they need to. And we're going to help low and middle income Americans access affordable, quality health care with a monthly tax credit that's immediately available. As Health and Human Services Secretary Price wrote today, this morning, our legislation aligns with the President's goal of rescuing Americans from the failures of the Affordable Care Act. Secretary Price also wrote that our bills are a necessary and important first step toward fulfilling our promises to the American people. I encourage you to read the bill and cover our action tomorrow. This bill is available to the American public. Contrast this to the Affordable Care Act. 2,400 pages, written in the dark of night and rushed through Congress. This legislation is a little over 100 pages, and every American can read and understand it. House Republicans promised a deliberate, step-by-step effort to provide relief from Obamacare and give people the health care they deserve. We take that critical first step tomorrow.
That we'd be happy to take your questions. Go ahead.
You've criticized Democrats for years for pushing through Obamacare before people had a chance to read it. But now you're holding committee votes as early as this week on a bill. Nobody knows how much it's going to cost. Nobody knows how many people will lose coverage. So aren't you doing the exact same thing?
No, not at all. In fact, the bill went online live for the entire American people, all of you, all of us to read, all of our colleagues to read at 6 o'clock last night. It's, as my colleague said, not that much to get through. It's pretty well understood. And it's keeping in practice with reconciliation legislation. As you know, when the Democrats did reconciliation, they didn't have a CBO score before it went up to the Budget Committee. That's pretty much how it operates. We'll proceed with our markups. There'll be a CBO score coming, and we look forward to that before it comes to the House floor. So all the members of our Congress have an opportunity to see that. Yeah.
Critics are already blasting this as Obamacare light. What's your message to your Senate colleagues who are already saying this bill will not pass?
Well, we had a good briefing with our Senate colleagues last week, walked through with them the various provisions. I'd encourage them to actually read the bill, find out what's in it. I've sent notes and copies over to some of the senators who are seeking the bill so that they can read through it. We are repealing and replacing Obamacare. We start with the 2015 reconciliation legislation as the underpinning document, and we're moving forward to get health insurance where it's affordable and available, to create more choices in the marketplace, and to do the biggest entitlement reform since Bill Clinton signed welfare reform into law. So these are big measures moving forward. We've certainly met the test of the president and Secretary Price, who believe this is repeal and reform. We will work with them, but we need them on board to make this happen.
Chairman Walden.
I might add, too, this is Obamacare gone. This is the first and most important step to giving relief to Americans from this terrible law and to begin the replacement principles of restoring state control and restoring the free market that conservatives, moderates, all Republicans have built consensus around. Dr. Price's own legislation last year, which we embrace in our Republican plan, had 84 co-sponsors, including members and leaders of the Freedom Caucus, the RSC, and the Republican Conference. We're following that consensus. And here is, I guess, my main point. As Republicans, we have a choice. We can act now, or we can keep fiddling around and squander this opportunity to repeal Obamacare and begin a new chapter of freedom for the American people. House Republicans are choosing to act now.
Can you comment on the president's Twitter post in which he said he liked the bill and it's open to negotiation? So how much of this bill are you guys willing to negotiate? On the one hand, you have conservatives in your own caucus that are going to hold a press conference later today and say that it's dead on arrival, they don't like it. On the other hand, not that Democrats are going to give you votes, but they're going to attack you guys for saying that it's going to cover less people and it's going to reduce the protections for people that are in the existing law.
We've held a lot of listening sessions with our conference members. I've met individually with the leaders of the various groups within our conference. We had a lot of discussions over the weekend with the White House and various folks there. It is a legislative process. We now have a bill that's available for all to read, and I encourage you to do it. I'd encourage them to do it. I'd encourage them to look against their own bills and what they've supported in the past. And then let's have a thoughtful legislative discussion. There's a process before each of our committees. There will be a process at the Budget Committee, there's a process at the Rules Committee, and then it will come to the floor. So this is an important step moving forward, though, to fulfill our promise to the American people to repeal and replace Obamacare.
Mr. Chairman?
Do
you view that the metric of how many people are covered is not the proper way to gauge the success of a health care proposal?
Well, you know, it's interesting because if you go back to what CBO predicted would be covered on the exchanges today, they're only off by about a 2-to-1 ratio. So there were 21 million they projected would be covered, 10 million are actually covered. And the worst part of that is we're chasing young people away from insurance coverage through the various Obamacare mandates. So as a result, 45% of those people who decided not to sign up for Obamacare and pay the penalty instead or get an exclusion are people under the age of 35. We need to reform those markets so we can give options that are affordable and available to more people to actually come on to insurance coverage. We also believe the reforms under Medicaid will allow states to innovate and drive more of their dollars into coverage rather than into the bureaucratic process they have to go through to get waivers.
Mr. Chairman,
What is the difference?
you previously said that the cap on the exemption for employer-sponsored coverage was one of the main options you were looking at to pay for the replacement plan. What was the thought process behind not including that in the final bill, and was that something that you decided on over the weekend?
Yes, so we have listened very carefully to House Republicans, the entire conference across the philosophical spectrum about how best to restore state control, how best to create a free market, and how to make sure we do that in a way that balances in the budget. We looked very seriously at the option of actually providing the same health care available at work to others through the exclusion. At the end of the day, our conference, the direction they gave us was that was not a provision they were comfortable today, and so we decided, again, to go a different direction.
Chairman Brady?
Mr.
Yeah.
Chairman, very simply, will this bill cover more Americans or less Americans than are covered right now?
Will it cover more Americans with affordable health care than today is probably the key question. Here's what I know in Texas, in our district. More people have opted out, found a way to get out of Obamacare than are taking it. And those who have it, frankly, can't use it. The deductibles are too high, the co-payments are too high. It's just a card. It doesn't help them. Under our approach, by returning innovation to the states and actually giving Americans a broad choice of plans they can actually use, I believe we're increasing access to affordable care for those who want it. And I think that's an important distinction here. And as I see the tax credit, I have a small business background as a Chamber of Commerce executive. So for decades, I watched small business people, entrepreneurs, mom and pop companies struggle to get health care. They get no help, while workers and big businesses got all the help. So under the Republican plan, for the first time, look, if you work hard and play by the rules, you're treated equally. You get that help as an entrepreneur.
Less people are likely to be covered.
So those businesses, frankly, aren't taking the Affordable Care Act. Those small business people, it doesn't help them.
Look, here's what we do know, that last year, 225 counties in America had one option left for people to choose from on the exchange. This year it's 1,022, and that was before Humana pulled out. This insurance market is collapsing before our eyes. The CEO of Aetna said it's in a death spiral. Those aren't our words, those are his words, and he's in that market. As I talk to insurers, they're looking at whether they can sustain the losses that they're now enduring because of the way the market's created. So the facts of the matter are not what this will or won't do going forward. Facts are we've arrived at the scene of a pretty big wreck, and we're trying to clean up the mess. And if we don't intercede now, fewer people will have access to insurance, period. We're not kicking anybody off Medicaid that's on it today. You can read that in the bill pretty clearly. We're going to devolve power back to the states, decision-making back to the states, and hopefully expand access to affordable insurance that people can actually take advantage of. But when you're down to 1 out of 3 counties in America, you got one plan, and in some cases next year we're hearing there may be 0. That's the gap that we're trying to prevent.
Chairman. Sir, healthcare is a complicated subject, we'll agree, but candidate Trump and even President Trump has been promising better coverage, lower costs, and better health care. Do you think you're on the road to that, meeting that goal right now with this?
Not only do I think that, I think Secretary Price believes that, and President Trump believes that based on the letter that they've sent, the letters they've sent us, the communications they've issued.
Mr. Chairman,
Yeah.
so could you just tell us, do you have internal CBO numbers and internal numbers of how many people may lose their health care that y'all are working with And is there a reason why you won't share that with us or the American people?
We are waiting for CBO to give us a score of the bill as it's printed.
And when do you think you will get that score?
That's up to CBO.
Mr. Chairman,
Sir?
can you explain a little bit about this insurance gap premium or hike, sort of fine or whatever it's being called, and how that's different than the current individual mandate?
Yeah, sure. So we're looking at continuous coverage. This is not a novel concept, by the way. You'll find a similar version of this to cover pre-existing conditions in Medicare Part B, Medicare Part D, and in the employer market. So we modeled it after that. One of the issues we found is that some people were gaming the system with guarantee issue. It's not that they had a pre-existing condition necessarily. It's they'd pay for 9 months of insurance, get 12, the other 3 for free, automatically come back into market. That was part of what's causing this spiral downward. What we wanted to make sure is if you have a pre-existing condition, you get coverage. And that the coverage is not rated based on that condition. It's just that if you let it lapse, if you didn't pay the premiums, there was a marginal penalty there going backwards. It's a little bit like you don't get to buy fire insurance for your house when the roof's on fire. You have to buy it ahead of time. It's a little different, I realize, when it comes to health care, but the concept is continuous coverage. You can have a gap of 63 days. Basically, that's 2 months. That's how it is in other areas of federal law today. Our goal is to make sure that if you have a pre-existing health condition, you're not denied insurance or priced out of the market, period, because of that condition. That's what we accomplish
To follow
here.
up on that,
Yeah.
for Chairman Brady, the repealing the Obamacare taxes amounts to a very large tax cut on the most affluent Americans. What is your response to critics who say this inevitably is a big tax cut for the rich?
Yeah, I disagree. I look at the 20,000 jobs that have left America because of the irresponsible medical device tax. I look at the health insurance taxes and others that drove up healthcare costs on Americans, especially those who could least afford it. You run down tax increase after tax increase after tax increase. They hurt the economy. They hurt healthcare. They achieved nothing. I don't want Americans to continue to struggle under the Obamacare taxes, which is why we are moving to repeal them, as well as the subsidies. And at the end of the day, as you all know, for this to pass the Senate, this has to balance within the budget and the window that we've been giving, and we'll make sure it does.
Sir, where are the deviations between the 2015 bill and this bill this year?
So, on the side that we're focused on, very little from the standpoint of repealing the taxes, the penalties on the mandates and the subsidies as well, making sure that we are defunding Planned Parenthood and redirecting those dollars to community health centers so women have those services where they need them. So we use the 2015 reconciliation bill as the foundation for repeal, but we go farther with those 2 key principles: returning state control so communities can get health care designed for them, restoring the free market so people can choose health care they need.
Yeah, from our standpoint, I think we have crafted the biggest entitlement reform in the last 20-plus years by going to a per capita allotment back to states for the traditional Medicaid population. I don't believe that was in the 2015 reconciliation bill. I think that's really important to empower states and to put Medicaid on a budget. So that's probably the biggest, and we have the patient stability and state stability fund in here as well, because there's just been all this damage done to the market itself. We want states to be able to come in, whether it's Texas or Oregon. We have vastly different decision-making that's gone on in healthcare in our states to be able to help out.
That sustaining fund, sir, is that going to be an annual pay-in by Congress, or is that going to be set up as an endowment that just sort of takes care of itself?
I think it's a $100 billion fund over 10 years. So it'd be about $10 billion a year out to the states that they could know that's coming to their states.
On the Medicaid, have you talked to any states that didn't expand and determine whether or not they would expand?
if this law were to go into effect?
We've talked to a lot of states. As you might imagine, I've heard from a lot of governors, had some very productive discussions. They can, I don't believe they'll be allowed to expand if they haven't expanded before, but if they have the expansion, they can add new people on until December 31st of 2019. Now, why do we do that? Because the states have told us, and others have informed us, that you've got to have a transition period here that works for the people that are on Medicaid and that works until Mr. Brady's tax piece is up online. And remember, with the insurance markets, it takes them a year or so to come up with the new plans and policies and get them out there. So what we're trying to do is what we pledged we would do, is not pull the rug out from anybody, make sure there's a transition to a better way with more policies, more opportunities, and a more fair health system.
Have they approved this proposal?
Just wanted to.
You'd have to ask the
I wanted to ask, just go in on that tax policy question,
Yeah.
your vision. You were talking about the importance of small businesses, and so this is going to repeal that net investment tax and the surtax at the upper end. And how does that sort of fit into your broader tax vision with the rate cuts?
Well, clearly, we have an economy that's struggling. Worst recovery in half a century. We got so many young people can't find good-paying jobs. A lot of people have given up. And so part of this is to remove the damaging, we think job-killing taxes in the Affordable Care Act, begin to lower the cost, but also it fits in to our vision of a tax reform proposal that's built for growth, built for the growth of jobs, of wages in the U.S. economy. And I think a key element of the tax credit is that it is really targeted and tailored to the individual. It's a credit that's immediately available to them. It grows and increases with age because your health care costs go up as you get older. It expands with your family because you have greater needs as a family. It's a credit that you can take from small business to small business, from state to state, home if you're starting a business or raising a family, even as you're approaching retirement. This is unprecedented freedom. And I would note, too, that in this legislation, thanks to the work of Chairman Walden, that those who are on the ACA today, who are watching it slowly collapse, they'll actually be able to buy products off the exchanges, including catastrophic coverage that's very important to them as we make this transition. And so it is very carefully and deliberately thought out.
Gentlemen, following up on that tax policy question, can you talk about the tax credit?